So and briefly, just to go over our program agenda, or we'll have shortly, I'll introduce you to a great panel of speakers, as well as then the moderator will share the topic overview. Each panelist will really share their focus and present on their side of the mental health and equity program design, as well as we'll have the moderator panel discussion and questions, as well as then we'll move into the open Q&A for everybody joining us today. And then we will close out and obviously send you all the additional resources from there. But just briefly, before we move on to these speaker introductions, with the Mission Forward workshops, our goal with that charitable ventures is to provide the increased and improved service, education, and that greater and deeper community engagement piece. And today's workshop will be lifting up a panel of these incredible experts to engage in a community conversation about what the current state of mental health needs in our community are, and what is that comprehensive approach to mental health equity, and what would that look like. So with that, I'd like to, I'm honored to introduce our panel speakers. So from first, we have Ellen Ahn. She is Executive Director from the Korean Community Services. And Ellen leads a vibrant and dynamic community health center and community-based social service organization in Orange County. In addition to overseeing the programs, administration, and the development of the agencies, she is and has been an active on many community-based boards and coalitions, including CalOptima, the Orange County Human Relations Commission, the Coalition of OC Community Health Centers, the Multi-Ethnic Collaborative of Community Agencies, Asian Americans in Action, Orange County API Task Force, and the California Institute of Behavioral Health Sciences, amongst many others. Ms. Ahn is committed to issues involving health and behavioral health equity, substance use disorders, family violence, and Asian American services disparities. So thank you, Ellen, for joining us, and welcome, Ellen. And next we have Ruben Cantu, and Ruben Cantu is the Associate Program Director at the Prevention Institute with 20+ years of experience in public and mental health through an equity and racial justice lens. He leads initiatives to address and prevent community trauma, improve community safety, and prevent violence, and improve mental health and well-being through the focus of community conditions. He is the primary author of California's Strategic Plan for Reducing Mental Health Disparities and serves on several state advisory committees. So welcome, and thank you, Ruben, for joining us. And next we have Laura Blank from the Wellbeing Trust, and she is the Policy and Partnerships Manager and with Wellbeing Trust, a not-for-profit impact philanthropy established by Providence Health and Services in 2016, dedicated to advancing the mental, social, and spiritual health of the United States. Prior to joining Wellbeing Trust team in May of 2020, Laura served as a public health policy lead in Texas Department of State Health Services Center for Health and Policy Performance, where her work focused on research analysis and of national and state policy impacting public health system and providing insight on best practices and service delivery models with the potential to enhance system improvement efforts. Laura also worked on both Medicaid policy and eligibility divisions within the Texas Health and Human Services Commission, and spent many years advocating for programs and policies that promote children's health through her work with the Texas chapter of the American Academy of Pediatrics. Her background is in public health, and with over 15 years of experience in the health policy analysis, advocacy, and implementation. Laura is committed to seeking policy solutions to enhance lives, strengthen communities, and transform systems and social structures to better support health needs and improve outcomes. And lastly, introduce you to our moderator, Jason Laxamana. Jason is the Director of Programs and Partnerships for the St. Joseph's Community Partnership Fund, a strategic grant-making foundation based in Southern California, but with investments across the Western United States, including California, Oregon, Washington, Montana, and Alaska. In this role, Jason designs, implements, and supervises innovative initiatives that will positively impact health with the ultimate aim of equity and justice in communities. This work requires a creation of meaningful partnerships with community organizations and institutions, and re-envisions the role of a funder as a collaborator. So with that, thank you again for the panel for joining us. And with that, I will turn it over to our moderator, Jason Laxamana.
Thank you, Brandon, and thank you to the team at Charitable Ventures. Thanks for reading all the bios, Brandon. Go get some water now. Yeah, drink up, throat lozenge. But thank you for having me, and I'm really excited to welcome our three panelists who are really leaders and experts in the field, but also very committed to community. I remember a couple months ago when Charitable Ventures reached out to me and expressed interest in hosting this convening on mental health equity. And I told them it was an important topic. But first I asked them what they meant by mental health equity. I say that because over the last couple of years, equity has become a buzzword. And rather than oversimplifying the issue and the goal, we wanted to have this session have it paint a more comprehensive picture of what is going on and what should be going on in this realm. I think we've all been part of sessions and conferences and other workshops where the focus when we talk about mental health and equity has been on increasing the number of services, increasing access to services. And this is important and very necessary. But services alone do not get us to equity. Instead, what we need is a comprehensive approach. Also, we need to be realistic about the resources available across the existing structures of support and funding, and to be honest, which have been less than equitable. I feel that to get to equity, we need this comprehensive approach of both the community involved, steered, and community appropriate, combined with accessible services and prevention. But not just prevention in the sense of preventive services, such as screenings and checkups, which are important too. But really, the prevention we're talking about is understanding what is driving inequity, and thus the community level trauma that is driving the individual trauma and distress that is leading to mental and behavioral health needs in our neighborhoods. Often, instead, it's an either or perspective, with practitioners and clinicians on one side advocating for increased services, trauma-informed care services, and culturally appropriate services. Then you have advocates and other practitioners looking at systems on another side to be more equitable, building community wellness, and more positive drivers to understand, alleviate, and prevent trauma at a community level, or at least engage communities to convert adverse community experiences to build resilience in those very communities. So what we're looking at, that instead of this dichotomy, is that we really need both, and we need everything in between. And we need to understand where each one of us, each one of you, are a part of that strategy, where you fit on that strategy of prevention, of upstream prevention, and how it links to downstream services. So today, we'd like to share and engage with you on this very comprehensive approach with leaders and experts who are engaged in each. It's a complex and challenging issue, and the way forward isn't easy. And I have no illusions that after the hour, we'll have it all figured out. But rather, I hope this is the start of a conversation of weaving these two sides of the same coin, laying out both the difficult realities, inequitable systems, but also the opportunities, innovations, and partnerships that are ahead of us in the community. So I'm excited to invite my three colleagues today, all of whom I've worked and learned from. Just a little note on each. Ellen and I go way back, I think going back 20 years working in this field, working in Orange County, way back to the Multi-Ethnic Behavioral Health Task Force that predated Prop 63 and the Mental Health Services Act. And ever since then, and continuing on, she's been a leader in this field, advocating for the community as well as innovative approaches in mental health. Rubin and Prevention Institute have been a partner with our foundation over the last several years, as we, as a foundation, have tried to innovate, we'll say, how we truly and authentically engage with community towards prevention, building equity in the process. And then Laura with Wellbeing Trust. And Wellbeing Trust and the fund are in many ways sibling foundations, though their reach is much more national and much more focused on wellness, on mental health, and creating conditions in communities across the country that address the needs and build awareness. So I'm happy to have them here with us. I hope it's a lively discussion. I'm hoping everyone here feels that they're a part of this, because you are. And at this time, I'll pass it over to them, and we'll, over the next few minutes, each will share a bit more about their work and perspective, and then we'll have time for some questions and hopefully just kind of like a discussion amongst each other. So let's get started. I will turn it over to Ruben to kick us off.
Thanks, Jason. And thanks again for the opportunity to share with you all today. I'm Ruben, and like Brandon said, I'm an associate director at Prevention Institute. PI is a national nonprofit organization dedicated to the practice of primary prevention, or as we like to say, preventing illness and injury before it has a chance to happen. A lot of the work that we do is rooted in the community environment and the community conditions, and those things around us that we can change to improve health and safety outcomes. We've been around for over 20 years at this point. We're based in Oakland, also have an office in Los Angeles and Houston and Washington, DC. I'm part of our safety and well-being team. I work at the intersection of mental health and well-being, community safety and preventing violence, and trauma and resilience. And as you could probably imagine, there's a lot of intersection there, particularly when you take a health equity and racial justice lens to the work in the way that we do. And I think this is one of the most important things that I could note for today's panel. There's really no way that you can talk about health equity without also talking about racial justice. The two are intertwined. The reason that we have health inequities today is largely because of the way that past policies, laws, and practices were developed to support specific communities and uplift them, and to exclude others, namely communities of color and specifically Black Americans. As I mentioned, PI focuses on preventing illness and injury before it has a chance to occur. And a lot of time that means taking a look at community conditions all around us that impact our health and safety. This approach really lets us to build in equity and racial justice from the start. So many of the challenges, like I said, that drive health inequities are rooted in these past and present policies that intentionally have disenfranchised communities. The most common example people usually cite is redlining, which segregated entire communities from opportunity, and which we now has led to increased exposure to pollution, for instance, isolating communities, and a lot of the subsequent health conditions that result from that. There's a quote from the Institute of Medicine that we use a lot in our work, which is, "It's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change." What we mean by this is that it's difficult to ask people to change when their context, the communities, their neighborhoods where they live, work, and play affect their behavior in so many different ways. And one of the areas in which we can see this clearly is by looking at what we call community trauma. When we usually think about trauma and talk about trauma, we usually are thinking about things like ACEs, or adverse childhood experiences. But we're also continuing to learn about trauma and what that means. As Prevention Institute worked with cities across the US that were particularly taking a public health approach to violence, trauma kept on coming up as a barrier for them. But they were talking about it in a different way. They said that trauma was something that also manifests at a community or population level. And it's not just about the number of people in the neighborhood who are experiencing trauma. They were saying that that community trauma is the impact of chronic adversity across a community And we start to see what we call symptoms of that community trauma that manifest in our relationships with each other, in the physical environment around us, and through our access to equitable opportunity. So we decided to look into this a little bit more, and with our partner at UCSF, Dr. Howard Pinderhughes, we started identifying what are some of the things that lead to this kind of trauma. And we found that it was primarily exposure to violence. But we also heard that it's not just about interpersonal violence, but it's also about the violence that comes from those systems and policies I was talking about that we call structural drivers. And when we look at those systems closely, we can see how the inequitable distribution of power, money, and resources can create conditions that harm communities. And this structural violence is that other type of harm that can contribute to trauma, particularly at the community level. What this ends up looking like is like damaged social networks, a low sense of social and political efficacy, the feeling that we can actually get something done in our communities, deteriorated built environment, those neighborhoods you walk into where you see boarded up shops and abandoned property, and intergenerational poverty. And so to counter this, what we talk about is the need to build community resilience, which is the ability of a community to adapt, recover, and thrive in the face of this kind of adversity. And it's not just about bouncing back, which is a lot of times the way we talk about resilience. It's about being able to bounce forward as well and continue to push against those forces that have harmed you. And it's rooted in those same kinds of community factors I just talked about, like social networks and trust, and the ability to have a living wage, and the availability of safe and affordable housing, and other factors like that. So the other thing that's important to note is to address that kind of trauma and community trauma, we need to focus on different solutions at the same time, kind of like what Jason was talking about. We know that doctors and healthcare providers recognize that treating the individual is important to address that kind of trauma, but at the same time, you need to do something about the fact that after a doctor's visit, you're sending folks back out to the same communities and neighborhoods, the same conditions that are contributing to their trauma. One of the best places to start building resilience is through healing. We always say that that's kind of the starting point. To building resilience. And for like individuals, that can mean things like trauma-informed care and mental health services. But at the community level, that can look like healing circles and vigils, or restorative justice practices in schools, or community dialogues to acknowledge transgressions and identify solutions for moving forward. So this is just scratching the surface of how we approach mental health and well-being through an equity and justice lens. There's a lot more to share, and lots of examples also. And I hope that some of that will come out through our dialogue today. And I hope that we can continue to stay in touch and continue learning from each other. Thanks, Jason.
Thank you, Ruben. And like you said, there's so much there, and there's so much, we could spend a whole week, if you want to go a grad school course on this stuff. We have about 45 minutes. So and that's why I think this is an introduction to the work that the three of you are engaged in and have been engaged in. And we hope that this is a conversation starter, and that there'll be follow-up. And to that end, please feel free to add your questions in the chat. We'll try to get to them. And if not, there will be a follow-up afterward. Next up, again, someone I've worked with over the last couple decades. It's kind of weird saying that, but Ellen On with KCS, or Korean Community Services, who's been a wonderful advocate and partner in this work. And I just want to turn it over to Ellen to share a little bit of your perspective and your experience.
Yeah, thanks, Jason, for giving away our ages. Hi, everybody. I'm Ellen On. I want to share with you just kind of how I got started. 25 years ago, actually in childhood, I had two of my aunts commit suicide. They were on the verge of immigrating to the United States. And here in the US 25 years ago, I have, they're no longer with me. I'm that old. But I had an uncle who was alcoholic, and it was disrupting our family. And I have another uncle who still struggles with chronic depression. And my family is like many of your families, impacted by mental illness in one way or another, and not fully well. Um, and and all of these family members spoke no English. And as the English speaking daughter of immigrants, I struggled finding resources. Actually, there was nothing. Uh, and so began my journey 20 some odd years ago as an advocate. Um, and the way I address this is to figure out how these I guess I'm the treatment specialist on this panel, is to figure out how treatment is paid for here in locally here in Orange County. And concretely, I just wanted to get services for my family members and other aunties and uncles and people that were near and dear in my circle of immigrants. And so, in a nutshell, equity for me means that someone, regardless uh, of their immigrant background or their language or the color of their skin, they have access to the same treatment resources that everyone else has. It's as simple as that for me. And so, mental health treatment, we can do a school lecture on this. Mental health treatment is funded through so many funding streams. I can't even I don't even know how to begin to summarize it, but in a nutshell, in California, MHSA funds a good bulk of it. And then a good bulk of it comes through Medicaid dollars, as well as private payors. And there's also some federal funding and some special projects like the Community Health Worker Project, CalAIM, ACEs. So there's hundreds of funding streams, but the big baskets are insurance payors, MHSA, and the Medicaid carve out for mental health and substance use disorder, which is distinct from Medicaid, the behavioral health Medicaid benefit, locally known as CalOptima. So it's complex. I think our job as advocates is to figure out that complexity, because the patient who doesn't speak English, who's suffering from chronic depression, cannot figure that out. I mean, that's our jobs. And so that's been my job in the last 20 years. And I, along with lots of leaders of color, have tried to operationalize this so it's actual meaningful services. So that patient or that client that looks like my uncle, whether they're African American, Latinx, Asian American, they have the same resources. And some areas are tougher than others in the treatment world. Psychiatry is particularly challenging, and medication, getting access to medication. This is an illness. This is, when we're talking about mental health, we are talking about what can be at the late stages an illness and should be treated like any other illness. The access to care should be available like it is for diabetes or some other conditions, but we don't tend to look at mental health and through that lens. And so we have a long way to go here locally in Orange County. I still wonder if somebody who speaks Farsi needs mental health services, whether they get services. An Afghani refugee, I'm wondering, let's talk about trauma and recent trauma. I'm wondering if the therapy services and the psychiatric services are available for them. I mean, I know that they don't exist. So our journey has just started, but I just want to end with kind of going back to my uncle. When I was able to really operationalize psychiatry, therapy, medication assisted treatment, substance use disorder services in some Asian languages, I saw the face of my uncle in many of our patients, and I saw recovery happen. And that's the bonus I live with every day, is that lives change in mental health And wellness is very possible. Recovery is very possible if we all systems make a commitment. Systems, foot soldiers like me on the ground, advocates, funders, if everyone comes together and realizes that recovery is really possible for communities of color, then I think we'll get to equity. So, yeah.
Thank you, Ellen, and thank you for sharing a lot of personal history and what is driving you. And I think for many folks on today's call, there's some similar experiences, that this is not just a job or not just a grant that folks are trying to fulfill, but it really is a deeper emotional responsibility that we feel we have. I wanted to introduce our last speaker, Laura, from Wellbeing Trust. And Laura and I have gotten to know each other over the last couple of years. And in fact, just like there are community coalitions, there are funder coalitions. And so Laura and Wellbeing Trust and the St. Joseph Community Partnership Fund have been on a California Prevention Funders Task Force. I think we're calling it a task force. We're engaged on things like this, on how do we work together? How do we influence policies? How do we have discussions with the California Surgeon General and the governor's office on more equitable policies that, one, prevent trauma, but also get resources for those trauma-informed care services that are out there. So really been wonderful to work with Laura over the last few years on that. But enough for me. I'll turn it to Laura to share about her own work and viewpoint on mental health equity.
Wonderful. Well, thanks so much, Jason, and thanks to Charitable Ventures for organizing this today. I think it's such a wonderful topic, and I'm really honored to serve on a panel alongside these other wonderful panelists and exceptional moderators. But I want to qualify one of the things that Brandon and Jason both mentioned at the beginning when they said that we were experts. I appreciate that, but I think I really want to acknowledge that the folks that we have with us today joining this call are really the experts. And as much as, we will, answer questions today and talk about some of our experiences and some of the work that our different organizations do, you all are really the experts. You are working within communities. You have your finger on the pulse of what's happening and what needs to happen, where there are barriers and where there are opportunities. And so I think, we have so much to learn from each other, and I'm just really excited about the opportunity for collaboration. So as Brandon and Jason mentioned, I'm Laura Blank. I'm the Policy and Partnerships Manager at Wellbeing Trust. I am a middle-aged, at least I hope, I have another 45 years, white woman. I have shoulder-length brown hair, brown eyes. I use she, her pronouns, and today I'm wearing a black shirt. So as previously mentioned, Wellbeing Trust is a not-for-profit philanthropy established by the Providence Healthcare System in 2016. And although Providence, the health system, operates primarily in 7 states in the West, our activities at Wellbeing Trust really extend across the U.S. with the goal of improving mental, social, and spiritual health of the nation. So equity is really something that's at the center of the work that we do. And as I mentioned, it's wonderful to see the interest and enthusiasm here. I think, we all are aware that mental health was trending in a concerning direction prior to the pandemic, and the impact of COVID, as well as recent events related to inequities surrounding racial justice, have really highlighted the need for meaningful change. So we at Wellbeing Trust work with a variety of partners to investigate needs, produce tools and products that highlight data related to mental health needs, and fund programs and promote policy to address these needs. I will say in the work that we do, and I think I can speak for my colleagues at Wellbeing Trust on this as well, we're really weary of sounding the alarm. I think we're all here today because we're aware of what the issues are, what the problems that we're facing are, but are kind of at a tipping point where we know that we need to work collaboratively to take action, to make change. Just as an example, the Mental Health Parity and Addiction Equity Act was passed in 2008. And just last month, I was having conversation with legislators about how this legislation needs to be enforced at the federal level to give people to the access, the care that they need. And I just feel like we've had that conversation over and over again. And so, as mentioned, my background is in public health, and one of the things in working in public health that we touch upon is emergency response. And within emergency response, and working in the state of Texas that has very diverse regions, one of the things that we learned is that when there is a disaster, and usually a natural disaster, but I think this can apply to COVID and the impact that we're feeling from mental health as a result of COVID. When there is a disaster, help comes from the federal level, from the state level sometimes, but it's really the community that first recognizes what's happening and what needs to be done to support themselves, their families, others around them. And so, with that in mind, we're in a place now where, yes, there are things that happen at the federal level, there are things that happen at the state level, but we're really looking to lean into communities, because the unique dynamics that exist within a community are so important in thinking of, what are the needs that exist, and what are the solutions, what are the assets within those communities to address the unique needs. So with June being Pride Month and us looking to July, which is National Minority Mental Health Month or BIPOC Mental Health Month, there's a lot to talk about from an equity perspective. And so I'm really excited about the timing of this conversation. And with that, I'll turn it back to Jason so that we can get into some of the questions and dialogue, and definitely want to have time at the end to hear from you all. So thanks again for having me today.
And thank you, Laura, and thank you to Ellen and Ruben for sharing also. And I see there's also a great discussion going on in the chat. So we're multitasking here where possible. I want to jump into some questions and really talk about, well, how do we get there? Again, we're not saying in the next 20 minutes we'll solve it, but again, some thought-provoking, some issues for us to consider. So, we've been talking about community level prevention, and we've also been talking about treatment and access to treatment in a culturally appropriate and responsible way. What does a comprehensive strategy, a comprehensive program design look like, and how do we get there? So an easy question to start off with our panel. I don't know, maybe Laura, do you want to take a stab at it first, and let's see where it goes?
Yeah, absolutely. Yeah, softball question at the beginning, Jason. No, I think it's a great question, and it's really important to think about. But as Jason, you've alluded to, it's a really tough nut to crack. I mean, there are so many social and systemic factors that go into shaping our mental health and well-being. And so I think, from Wellbeing Trust, and I'll just kind of position this from the structure that we've created to look at this. And I'll try to, I'm not as good at multitasking as Ellen is, but I'll try to drop a link into the chat here while I talk. But one of the things that we use to organize our thinking around this systems approach to addressing needs, mental health and addiction needs, is something that we call Framework for Excellence in Mental Health and Wellbeing. And I'm gonna put the link in. And I know Brandon's going to send materials out afterwards as well that will include that. But I think, we recognize that there are social factors, there are these community influences, as well as these different care systems. And I mean, these range from not just the healthcare system, but the schools, the judicial system, workplaces. And then, of course, coverage underpins all of it, having access, parity, financing for services. And so there's a dynamic interaction between these areas that I think it's really important for us to recognize. We know that holistic care is really complex, and that there aren't many entities that are able to span all of these different factors. And so, different organizations work within different spheres or sectors or within different care settings. But the framework is really to help organize thinking around that, so that, if you are working in a healthcare setting, you don't lose sight of the fact that holistic care really is inclusive of these other upstream community factors that are playing a part and coming to bear on somebody's experience and their mental health and their well-being. And so I think, as an example of this, if you're a healthcare provider who prescribes a medication to an unhoused individual that needs refrigerated, you probably haven't done a lot to improve their situation with that medication. And so, making sure that people have a frame of reference for thinking through all of the different things that may be factors for people in their mental health journey, I think is something that's really important. And so for us, we look across these different sectors, look for where there is opportunity for collaboration, and really try to think about, if we only invested resources in one of these areas, we wouldn't do much good, because there are these other pieces that are really important in terms of seeing improvement and advancing the thriving that we hope that everybody can achieve.
Yeah, this question is challenging, because a comprehensive program design is not something, it's already something that exists in theory. And there are multiple funders to it. There's multiple funding streams, much bigger than clearly this group, everything from MHSA to managed care dollars to private payors, that is, billions and billions of dollars in our state funding this comprehensive design. And there are big entities that determine how this plays out in communities of color. But locally, we are a minority majority county. We are almost a quarter Asian, mixed race Asian. I don't have the specific population for Latinx and African American communities, but this is no longer a white majority county. But the systems haven't caught up to that reality, that demographic reality. And so whether it's a prevention program with school-age children, or it's a residential treatment, facility, or, Mind OC and Be Well, or, health systems that provide mental health care, that entire system of care, from primary prevention all the way to treatment for the SPMI population, the severe persistent mentally ill population, that entire kind of spectrum needs to be addressed with an equity lens. That's how we create a system that is truly equitable for communities of color. And so instead of trying to create something or a new program, it is to work with the big entities that already exist, whether it's I'm being very local, but whether it's CalOptima or Healthcare Agency, or some of the other systems in our county, to make sure that there is an equity lens and that there are penetration rates that are proper for the demographics in this community. That's how you start making a dent, at least in my opinion, on whether community level prevention and individual, that entire spectrum is shifted so that there is true equity that exists at all levels. So it's very complex, but that's where we can start because we're not starting from scratch. I mean, there are entire systems out there that are beyond this conversation, but
I would agree with all of that. I think all of us get and understand the need to have a comprehensive program. I think there's a story that I tell a lot in a lot of the presentations I do, and a lot of people have probably heard this story about these three sisters who were walking along the banks of a river, and they come across a lot of children floundering in the water, some of them drowning and in crisis, right? And so one of the sisters jumps in and starts pulling the children out to save them. And then the second sister jumps into the water and starts teaching the children how to swim. And so that's another form of prevention, right? And then the third sister starts walking further upstream, and the other two sisters are saying like, hey, where are you going? We need your help here to like rescue these children and to teach them how to swim and how to survive. And she says, yes, but somebody also needs to go upstream to figure out why these kids were in the water to begin with. Maybe there's a bridge that kind of like wore down, or maybe there's something else that happened that's kind of leading these kids to kind of to fall in the water. And when we, a couple of years ago, Prevention Institute did a project in the state of Ohio to help folks who were working on the opioid epidemic come up with a prevention strategy that was comprehensive in this way. And when we go upstream, we have people overdosing, on the sidewalk in front of the library. But as we kind of worked with them and had them kind of really look at their communities, look at the data that they had, look at who was in the community and start talking to the community to identify the different things that were driving the epidemic, and having them start to identify things beyond overprescription of drugs and other sorts of factors that were kind of contributing to that. They started realizing and identifying that one of the things that was contributing to this were some of these root causes like intergenerational poverty, social isolation, and all of these other factors that were driving the harm that caused people to realize or to think that opioids and other drugs was like their only choice to help dull the pain that they were feeling, right? And so they came to the realization that we need to focus on not only preventing people from dying, but preventing people from also turning to substances in the first place, so that they could have that comprehensive approach. And what they realized was it takes multi-sector partnership. It takes being able to kind of take a collective impact approach so that folks can, so that not everybody has to do like the one heavy lift all on their own, and that it takes a redistribution of funds so that it can focus on things along that spectrum of prevention and treatment. And those two are like so intertwined. Like we also see that if you once you kind of get to the point of treating folks for, whether it's a substance misuse challenge or mental illness challenge, like once you kind of get people in recovery and get people to a place where they are able to draw on their capacity and their capabilities, those people end up becoming part of the system that can kind of help to advocate and strengthen this comprehensive program design also. So all connected.
Thank you, Ruben, Laura, and Ellen. Yeah, I think all good points there. And I'm also monitoring the chat, some lively discussion there. I do want to go back to the analogy, metaphor, parable that Ruben brought up about the river. And that's something that I've, a story that I've used also. I think how it also applies to us and every person that's a part of this session is to realize what role you're playing. Which sister are you? Are you the sister diving in and saving the children right in front? Are you the sister that's going up a little bit upstream and teaching the kids how to swim so they can survive in the water? Or are you the sister that is out there going upstream trying to see why these kids are in the river? I think part of the challenge that we have in a community, not just in the funding community, but also in our community of nonprofits and institutional providers, is that we look at mental health as one big it. But within it, we don't realize the part that we play within that. And so I think about the question that Deborah posed is like, there's so many forces at play here. Where do we start? And then I think about what Ellen said. Everyone's doing stuff. We're all doing things now. It's not that we need to recreate a comprehensive strategy. It's out there. I think what we need to do is realize what part of that strategy, what part we're playing, and also not overpromise the work that we're doing. I think a lot of us maybe think it's like, oh, we're doing, well, not a lot of us, some in our circle are saying, well, I'm solving inequity. I'm solving mental health inequity. And I think there has to be this realization that we can't do it alone. One single entity, organization, even if it's the county, and I don't think there's any county folks, and even if they were mental health folks, I mean, at mental health, the healthcare agency, they'll tell you that there's a lot that they still need to do. And institutionally, in the way that contracts are driven and such, there's a lot of room for improvement there. But what's important for us is we can't do this alone. And my answer to Deborah is like, start wherever you are, but then start reaching out across, realizing what you're not doing and start working. And I think that's what Ruben was saying, that, okay, there's a lot of sectors here. And that segues a little bit to the question that we have. How do we foster those multi-sectoral community partnerships involving the providers, the advocates, the researchers, those focused on treatment and those focused on prevention, since it's all out there already? So how do we do that better? How do we connect better? And I'll toss it out. Who wants to start? Who wants to take that one?
I mean, you already see some of it happening. My expertise, because I know what part I'm in the treatment part, and specifically for this conversation, I have an expertise in Asian communities, and so I do know the nonprofits that are very good at the prevention work and the upstream work. We rely on them, and our frustration is not actually, are we making those connections? Because many of us are informally. Our frustration actually is in those different points on the river. I mean, Ruben, I think you get the award for like a great example for us to conceptualize this, is at those pieces, because clearly my expertise is the jumping in the river person and getting the folks in crisis. But what is the depth? And are we missing at that point the family who is of color? Are we just saving, the certain types of folks, but not other types of folks? And then for my partners, because I don't even purport to have expertise in upstream primary prevention work. We dabble because we all have to work together. But for other leaders, like, for example, Okapica, who does a lot of prevention work, are they reaching that Asian family? And is there enough resources for them? And I'm just looking at my little lens of the world. Those are kind of, I think, the bigger questions. I do think there's just so few of us in Orange County who are doing this work, the traditional nonprofits, that many of those relationships are at least informally started. Maybe there could be some more formal, thinking this through. But I think we've had to informally make those partnerships.
Yeah, I totally agree with all of that, Ellen. So many of the problems and challenges that we face are like so big that it's hard for any one organization or agency to really kind of try to tackle it all, right? Which is why it's important to have that kind of partnership. And I think a lot of times when people think about collaboration, they think about it on a very surface level, like let's share information, let's do an event together, let's coordinate something. But the way that I think one of the ways that I've seen it be most helpful is to find partners that kind of share a mission or share a mandate to be able to want to do something in the community, and looking at those people so that you can actually move beyond just sharing information or sharing an event, but actually like developing strategy together, and doing it once you're able to have those conversations so that you can identify like, what is it that I want to get out of it? What is it that you want to get out of it? And hopefully the answer is aligned. Like, we want to make sure that this community is able to thrive, right? And it's really hard to find those kinds of partnerships, because a lot of times that means also like, especially if you're collaborating with city or county agencies, it means them having to give up a little bit of their power and a little bit of the resources that they have. But it's really important to be able to do that so that not only you can kind of like ease the lift, that's kind of what I was talking about earlier about like having kind of a collective impact approach where everybody is kind of like integrating into your mission, your mandate, your goals, but then lightening the lift a little bit for everybody and making sure that you're, getting to and addressing those needs that people are really facing. And it's hard work, but it takes time to like have those conversations with each other to get to that point, which is also like, in short supply too, but in the end, it's worth it.
Well, I've been doing this work a long time, and equity is the new trend, right? The focus, the COVID-19 really kind of brought it into focus. But for those of us who have been doing this work for a long time, it's just been a part of our work. I think we all have a responsibility too. It's right now, in the spotlight, but when it wasn't, we're still trained to when it wasn't, and many of us function with a scarcity mindset, right? And we because so few resources and so little attention was paid to this topic. And so I do think it's incumbent on those of us in the field, whether you're a prevention leader, where you are on that river, to really look inward and say, where am I exactly? And where can I do the best work? And how can I get out of this scarcity mindset where I'm trying to sell that I'm great at everything, as opposed to, what is my expertise? And then also to lend some grace to nonprofit leaders, because we have been functioning in that space for a long time. So for the funders or the decision makers and the policymakers to lend some grace and to orient nonprofit leaders in that way so that they become deeper in what they do as opposed to broader. I think that's really important as we build this partnership and this spectrum in addressing mental health equity.
Ellen, and I think what you're saying is so important because, within public health and within mental health, I think there has been such a lack of investment and resources available that, the model amongst a lot of different groups is to kind of fight for their piece of the pie. But I think instead we need to shift the thinking around, what is my area of expertise and how can I work with others to not recreate the wheel so that we're maximizing, the limited resources that are available, and really working together to move common objectives as opposed to, fighting over the scarce resources. And so, everybody recognizing their role in that and having the and making the time. I mean, honestly, it's a time commitment. Making the time and taking the opportunity to work with others to advance those common objectives, I think is something that's really, really critical if we're actually going to make a difference and move the needle.
I think what you've both been saying is really important. In fact, I was on another panel last week, and part of the discussion was about nonprofits focusing, well, realizing then focusing on what their core work is. And this was in response to a question about funding and sustainability and fundraising. And it really was, don't chase the money, but really in this regard, what we're talking about here is like, focus on your core work. And it goes back to the Three Sisters examples. Like, what is your core work about? I'll give an example from an initiative that we funded a few years ago. And it was really around this idea of trauma prevention. And it was a lot of coalitions, and we had backbone organizations who are leading the work. And we had one backbone organization who is really a leader, I would say even a nationwide leader in trauma-informed care. But after a few months, they met with me and our team and said, you know what, I don't think we're the right group to lead this. You know, what you're talking about is really this upstream prevention, addressing community factors. We know how to deal with ACEs and, you know, screening and getting services to those that need it in a very appropriate, culturally appropriate and trauma-informed care perspective. But what you're talking about is not our expertise. So they actually bowed out of that backbone role. And there was another organization that stepped in, but they stayed a part of it because they realized, you know, this is important for us. We're good at what we do, but we need to learn and we need to interface with those other groups who are working in that upstream so we can see how we're connected. And I bring that up because it also takes a certain level of it's like an existential level. Like, who am I? What am I doing? And from the perspective of an organization. And I think that's actually a very responsible and important consideration for all of us to do. And it's really that idea, like, which sister are you? But then knowing, hey, we're still part of the same family. These are my sisters too. We're working together on it. And I can learn from each sister. And you know, as we've been saying, this is not something that's going to get solved in an hour. It's not going to get solved this year. I think even in the course of our lifetimes, we're going to be working on this. But what we're talking about is maybe over the course of the generation and the next couple of generations, we're creating a structure that is equitable and there's wellness in our community. And that's still something for us to strive for. I see you're unmuted, Ellen.
Oh, yeah. I mean, it's mental health is unique in that the community actually pays for most of it, whether it's prevention or treatment, anything along the spectrum. Yes, there are philanthropy dollars, but in the grand scheme of things, they're taxpayer funded programs. And it is our community and it is about social justice in seeking those programs. So there's a role to be played for the community itself that benefits this, not just those of us in the profession, but the community itself exercising what they paid for through their taxes. And it's whether being advocates at the school or utilizing their Medicaid benefits or their insurance benefits. There is a role, and that's what I was thinking, that community partnership, in addition to providers and advocates, and you know, it also includes the payors, which is the communities of color that are being disproportionately impacted themselves.
Sounds
We forget that we are public servants, many of us in the mental health field. And the other kind of thought that is somewhat related to that is many community of color leaders, we fight for the same piece of the pie, whereas we really should be thinking about in 2022 expansion of that pie and coming together about how to get that pie bigger, because that pie is, if we are looking at the payor and who actually paid for that pie, it must be bigger. I mean, it is my uncle and my aunt who paid for their benefits, that paid into that system. And our job is just to operationalize that in one way or another, as opposed to trying to attack that, you know, piece of that little pie, and we get nowhere. We spin on a hamster wheel sometimes doing that.
I'm going to do my best, Phil Donahue, or Sally Jesse impersonation. But Ellen, it sounds like what you're saying, that a solution to our mental health situation is civic engagement and advocacy.
Oh yeah, that's interrelated too. Absolutely. I mean, it's keeping the policymakers accountable for those taxpayer dollars that are funding this entire system of mental health care, whether it's, you know, outreach work, prevention work, treatment work. And of course, civic engagement matters because these are taxpayers and voters.
We had a convening recently where one of the attendees, who is a brilliant a brilliant mental health specialist who has worked internationally and has a lot of experience with global health and delivering services in resource poor settings. And he said, you know, it's so funny to me, in the US, the system is designed around everyone except who it's meant to serve. And when you think about, you know, the payers and the providers and the patients and the policymakers, you know, those who are making decisions and responsible for that accountability, really don't always understand what it is at the community level, that's driving need. And so I think, you know, as we think about the system, that civic engagement that you're talking about, Jason, is really important, and it's daunting. And I think for a lot of people, you know, thinking about, you know, how can I make an impact on this giant system, you know, with my little corner of the universe here. But I think it's so important, and a lot of the work that we're doing now is to really fund some work, like the United States of Care is doing some work, that, you know, they're focused on access to healthcare services, mental health being one of them. But I think, you know, in their journey, what they've learned is that the community knows what it is that they need, and listening to them and being a champion for what is needed at the community level is really important. And I think, you know, we see that with youth as well. You know, for many years we've said, oh, here's what youth need. But youth have a voice, and they think about things very differently, and they have, you know, a whole different experience around technology and the way that they're experiencing the world. And so I think, you know, doing that deep listening and respecting, you know, these diverse experiences and opinions is really important in terms of putting in place the types of services that people need, articulated from the voice of the people.
Community members and residents are the experts in their communities. They're the ones who know best, like the challenges, the problems, the ills that are facing that community, and they have the solutions. They have the solutions kind of like in a big picture way, right? Not in kind of the granular, like, this is a piece of legislation we need to write, and this is what we need to include in it, and this is the process we need to take to get it done. But they know what needs to happen. And that's one of the reasons, again, why it's important for collaboration to happen, so you can have the groups that know how to get stuff done at that granular level, and the folks that have the vision for what needs to happen to get things done. And it's really why it's important to make sure that you're engaging and involving community members in your decision making, in the leadership of what's happening. And this is particularly for like public agencies and other folks. I know that, like, you know, KCS does this kind of work, and other nonprofit organizations that are like really community rooted and community focused do this, but it's a lesson for other folks that you need to really make sure that you have that voice in the work you have, and you're providing opportunities for those folks to kind of like take that power and being able to flex it, to borrow from Wellbeing Trust, like flexing the civic muscle that's necessary to do the work.
So with both Ruben and Laura's point, the key is action. I mean, I don't mean to be really blunt, but like there are, I don't know, I've probably attended hundreds of focus groups, polls, surveys, asking about what my community needs. And the answer is actually pretty simple. Somebody who walks in my door needs a therapist. I mean, there are practices in the treating mental illness is a treatable condition and recovery happens. There's lots of research around it. We need it in language. I mean, we're spinning wheels when we try to listen to communities without action and follow up. We actually burn bridges because communities of color basically say, what's the point? I don't want to talk if I'm not being heard. And I think we're at that stage, as opposed to just let's do another listening session and let's do another focus group, or a poll, a survey monkey. I actually think we have the resources, we have the expertise, the nonprofits, the will now and the attention, and that in 2022, we have the answers. Actually, there are numerous studies and there's data points where we know what we need to do. And so I don't know, maybe I'm getting a little too emotional, or I've gone through too many focus groups.
No, this
But
is good.
yeah, it's almost like the community is being used for that check mark. We listen to the community, and what next?
Yeah, and so I think we got 2 minutes left, and so I think it's been a very energetic and important discussion that we've had. But in a way, to sum up, I think what we're talking about is collaboration. Well, to the point, Ellen, we're talking about action and accountability, and that's what we hope to have here. And I think as a funder, we're not an expert, but we're here to support and authentically engage and partner, and that's what we want to do. So again, this is a conversation starter. We weren't going to get everything. There's so many more questions. We're happy to engage. But before I pass it back to Brandon to close it out, maybe like one word or one sentence to leave us with from each of our panelists. And maybe we'll start with Laura. What's one takeaway for our folks?
I think the direction that we're trending in is very much in line with what Ellen just said, that we need to do something different, because things aren't getting better, and we need to empower communities to use their assets to do that. And in the information that Brandon will send out, one of the programs that we're initiating at Wellbeing Trust is around Strengthen Us, recognizing that there are all sorts of barriers to clinical care, and it may not be that you don't have insurance. It may be that you're hesitant to engage. It may be that there aren't providers that look like you or don't understand your situation, and so you don't want to go to that care. And so I think for us, we are really interested in seeing how we can leverage some of the community assets through peer support, community health workers, and really empowering lay people to support the mental health needs of those around them. Because who do you talk to when you're sad or when you've had a tough day? It's usually somebody close to you that you trust. And so how do we embed those skills to really help change trajectories? Because I think so much of what's happening now has not gotten us there.
Ruben, quick takeaway.
I'm going to try to make it quick. So these are more like takeaways and calls to action. So For funders and philanthropy, we need resources to go to community-based organizations that have strong, trusting relationships with community members. For local government, we need to have those in power start to share that power by bringing in new community-centered, community-focused leadership to help shape health and safety activities and programs. And we need folks, again, in local government especially, to move beyond talking about racism as a public health crisis and actually take action to dismantle those systems that have harmed so many across the centuries, basically since the founding of this country, so that we can get to that place where we need to be. So
Awesome.
there, yeah.
Ellen.
Yeah, I just want to end. I mean, today's conversation was mental health, but it really, the focus is mental health equity. And when we're talking about equity, we're talking about communities of color. And so I'm a treatment person, is I just ask everyone to walk in my uncle's shoes. Someone who speaks English, has multiple barriers, economic, educational, and facing a substance use disorder or a mental health disorder, what they would need. And I think the answer is pretty simple in what is required in that situation.
Thank you. And what I'll say is, for many of us, for many groups, for many folks, we've all been struggling alone. I think what we need to do is struggle together.
Mhm.
And there's a certain poetic beauty in that, but I think only by struggling together will we get to that vision of equity. And so I want to thank you all for participating. It's been, I think I've learned a lot also. And that's one thing funders should realize. We actually don't know much. We're here to learn from everyone here. And I certainly have, and I wanted to thank you. And I want to thank our hosts, our panelists, Laura, Ellen, and Ruben. Please reach out to them if you have other questions. Please take a look at the packet of information that's going to go out that Brandon will send. And thank you to Charitable Ventures for hosting this. It's been such a robust discussion. I want to turn back to Brandon for a quick goodbye, I guess.
Yeah, no, thank you, Jason. Thank you, Ruben. Thank you, Laura and Ellen again, just really driving this conversation. And like you all said, it's a conversation, it's a starting point, and it's working together and moving into action that's going to make that difference. So quickly as we wrap up, I know we didn't really have time for that Q&A, but please, we'll hang around. We'll keep this room a little open, but during that time, feel free to drop any of questions that you do have in the chat. And that way, we'll be able to just put those all together, and the panelists, they're more than happy to answer those, and we'll send those responses out to everyone. Additionally, like as Jason mentioned, we'll be sending out not only the recording of this, but the resources that the speakers are sharing and their contact information. So that way, again, we can have that collaboration and work together to make that difference. And so if there's any questions, again, please feel free to drop them in and we'll be hanging out. But thank you all very much for joining us, and we hope you have a great rest of your day and week. Take care, everyone.
Thank you.